Vice-Chancellor, graduates, ladies and gentlemen, I am delighted to receive this honorary doctorate in health, and I accept it to develop what we've called people-powered health at Nesta and beyond. Nesta is an innovation charity dedicated to supporting ideas that help improve all of our lives. And over the past 6 years, we have tested and grown new approaches to health and care, which put people at the centre. I'm particularly pleased to be receiving this honour from Anglia Ruskin University. You are well known for your excellent training in health, care and education. And most importantly of all, congratulations to all of you for receiving your degrees, your diplomas and your certificates. And given how good you are at cheering, I think we need another big cheer for everybody who has received a degree, a diploma or a certificate today. Another big cheer as big as you can. That's fantastic. And today is about recognising the dedication and the hard work it's taken all of you to get here today. Reflecting on my work in health and care, here are a few thoughts to share with you as you start the next stage of your professional life. Firstly, you are all highly valuable, whether you've trained as a midwife, as a social worker, as a nurse, in early years, in education, or some other related field. You are all absolutely essential to the future of a healthy and a strong society. In fact, the health and care system needs you more than ever. As you know, the system is under a great deal of pressure from rising demand and from financial stress. And because of this, what you have to offer is even more important. Your professional skills, your compassion, and your dedication to improving the lives of other people. And people like you are at the heart of what we call people-powered health. So what is people-powered health? What does it look like? I thought I'd give you a couple of examples of what putting people at the centre of their health and care looks like in practice. One is about the difference it makes when people are truly listened to, and the second is about staff problem-solving at the front line. The first example is a man I met in Huddersfield a few years ago called Paul, in his 60s, an ex-miner. He told me the shock of being diagnosed with a lung condition. He thought he just had a bad cough. The doctor told him to start exercising, but he left the surgery feeling overwhelmed, depressed. He was scared of doing exercise, getting out of breath, and what that might lead to. So he withdrew into himself and did less and less over time. And this, of course, made his lung condition much worse. So after a while, he wasn't able to move more than a few meters at a time. People-powered health is about moving away from failures like this towards a system that really knows how to support people like Paul much better. Firstly, it's about great conversations, conversations with professionals like you, conversations that are open and in which people are really listened to. In the end, Paul was connected to a specialist pulmonary nurse who talked to him and found out that he used to be a champion swimmer in his younger days. So with her support, step by step, he increased his confidence, and by the time I met him, he was swimming several lengths of the pool every week. In his own words, it was a miracle. The other thing that really helped Paul was joining a local peer support group with other people with lung disease. This group helped Paul to feel less alone, and it gave him new skills. He's now helping new members of the peer support group when they first arrive at the beginning of their journey with lung disease. So these two things, a professional really listening and connections with peers who really understand what it's like, are at the heart of what we call people-powered health. But the people in people-powered health are also empowered professionals. We do a lot of work with professionals to motivate and inspire them to work better together, focusing on a shared mission, something that can get lost in the busyness of frontline work in an overstretched system. In one hospital ward in Harlow, in Essex, very close to where many of you have been studying, staff were asked to help to improve discharge out of their hospital ward, and they spent time talking to patients. It turned out that the older, frail patients preferred to get home as early as possible in the day so that they could settle in back at home before night falls. But the hospital had always assumed it was important to give older patients one last hot meal before they went home. So they switched from an afternoon discharge to a morning discharge. And this wasn't only better for the people who could get back to their homes quicker, it was much better for the hospital because it freed up beds sooner, which improved flow through the hospital. And this came about from staff themselves, frontline staff, solving problems together. So given that, here are a couple of thoughts for you as you embark on your next chapter. Firstly, be a great listener. Listening is an incredibly powerful tool and really can make all the difference. Secondly, be a problem solver. When you see something that needs to be fixed, work with others to fix it. Sometimes the best solutions are the simplest. The combination of these, listening and problem solving, will, I think, set you up in good stead, not just for a successful career, but for achieving what's most important of all, making a real difference to people's lives. So thank you once again for the recognition of the work that I've been lucky enough to be involved in. I hope all of you become living exemplars of people-powered health in action. Good luck and thank you.